As for vaginal estrogen, why might I choose a suppository versus a cream versus the ring? There are a lot of options.
You're right, there are a lot of options. And the answer is a lot of it's personal preference. And I'm going to walk you through a few of them and talk to you about why one might be right for you or another. So one of the ones that a lot of patients like who are old and remember the Ron Popeil set it and forget it is the vaginal ring. So this vaginal ring gets placed just below the cervix and it releases a constant amount of estrogen every day. You leave it in for 3 months. You can have sex with it. You can take it out if you need to. You can reinsert it yourself. It doesn't require a doctor to reinsert it. And it's really great for the patient who doesn't want to think about it. You automatically get your estrogen. It is not going to affect your blood levels of estrogen, though. This is just for vaginal tissue. So this one's really great for those who don't want to do a lot. One of the ones that I like is the suppository. So it's a small pill. I'm going to shoot it out here. Boom. About this size. You put it into the vagina, insert it with this applicator twice a week. It absorbs at night and doesn't create a lot of discharge. So this one is a great option. It's pretty easy to use as well. Vaginal estrogen cream, a lot of patients get started on this initially. It's cheap. It is nice for the mucosa because it's slightly lubricating. I find it's really messy though, all right? It comes with this applicator and you have to fill it and then you place it vaginally, or conversely, you're putting a large amount on in your finger and you're really rubbing it in like you are using a toothbrush without any toothpaste and you're rubbing around the vaginal tissue for like a minute or two at night. I'm sorry, I just don't have time for that. And again, it can create a little more discharge, but it is nice and it can be good for some of the inner labial tissue as well. So the short version is there are a lot of options. When you start with one doesn't mean you can't switch to another. So pick what's one you're going to stick with and you're going to use the most, because that's the important part. We want to get your vagina the estrogen that it needs, and it doesn't really matter how you get it there.